Hello, my name's Gazelle Crasto, and I'm here at the University of Toronto working on a PhD. Remember the last time you had a paper cut? Your body healed that paper cut naturally. So what happens in the case of broken bones? We all know of people who've broken their bones where the doctor set it in a cast and over time it heals naturally. So in the case of serious bone damage, for example, when you're in a car accident or a sports injury or even cancer patients, where bone is removed as part of the cancer, the bone does not heal naturally. Now this requires multiple surgeries in treatment, and often surgeons will take bone from the hip or the leg, and even sometimes bone from deceased people. As you can imagine, this process is painful and requires a long recovery time. So what happens in the case where bone doesn't heal naturally? How do we build broken bones? My research seeks to address just that question. Now we can grow your bone in your body in a controlled, targeted, non-invasive way, which is less painful as well as has a quick recovery time. So I began by engineering these little nanoparticles or small particles called as liposomes. Now liposomes are really small, so small that 1,000 of these liposomes can fit in the width of a single human hair strand. Now liposomes have been around for decades. In fact, some of you have probably got it as a treatment for an eye infection or perhaps a fungal infection. Within these liposomes, I incorporated a protein called BMP, which stands for bone morphogenetic protein, as you can see in the slide. BMP is naturally found in your body, and your body uses it to heal broken bones. So when incorporated inside these liposomes, the BMP is completely invisible to the rest of the body. So, as you can see in the illustration in the slide, the BMP-containing liposomes are placed in the site of injury or the location of injury where bone growth is needed. Now, ultrasound shakes these liposomes and shakes them so hard enough that they break apart, releasing the BMP. The BMP can then jumpstart the healing process and make bone. Now, why is it interesting to use ultrasound? Well, ultrasound helps us to control how much BMP is applied onto the site, where it's released, as well as at what point in time it's released. Now, this is all important because as patients, we all heal differently. We also all have different damage to our bone. So controlling this means we can get better treatment. But what's most important, we as patients can get treatment in just one surgery with less pain, a quicker recovery time, and a better quality of life.